You know, it seems the older that we get, the more health issues that we have, and especially with our eyes. Our eyes get worse, and we sometimes wonder what could be causing it. Is it hereditary? Are we just getting older? What? Well, we've brought in someone to talk to today about this, Dr. Ann Baranano, who is with the Retina Specialty Institute here on the Gulf Coast. Thank you for being on the show with us.
Sure, good morning. Thank you for having me.
Tell us at first, what's the difference between an optometrist, somebody we just go get our eyes checked, and a retina specialist?
So there's a few different levels. An optometrist is somebody who's specialized in checking the general eye health of the eye, glasses, contact lenses, things like this. An ophthalmologist, a general ophthalmologist, has gone to medical school and can do surgery on the eye, lasers, other treatments. A retina specialist is somebody who's done further training, and so they're subspecialized within ophthalmology, and they really deal with diseases in the back of the eye, which is where your retina is.
Now, as we get older, of course, we have different things that we have problem with our eyes. One of them, quite often, I mean, I know some people who have gotten older that they still have great vision, no problems whatsoever. But then there's those of us that, you know, even as we get in our 50s, we start having some problems. One of the bigger problems is macular degeneration. What is that?
So that's a very good question. You know, it's especially important since we just had the senior health fair at the Biloxi Civic Center. And that was a great event. It was wonderful to see so many people coming out.
Glad to have you part of it.
Oh, thank you. We enjoyed being part of it. But it was great to
see
see the community really support the health of our senior citizens. And age-related macular degeneration is a very common disease here in the United States. Over 1.1 million people, Americans, are affected with vision loss because of macular degeneration. And that number is only expected to increase by the year 2020, almost 3 million people. So it's an important disease to talk about. Basically what happens is that as the eye ages, the retina can't keep up with all the work it has to do. And so sometimes it gets thin, or to let trash or kind of byproducts of the visual cycle build up. And that over time can lead to kind of degeneration of the retina, which ultimately can lead to central vision loss. The disease does tend to affect the macula, which is what takes care of your central vision. In the early stages, people don't even have symptoms, so they may not even know they have it. Later on, as the retina becomes thin, or even as it develops swelling or bleeding from wet macular degeneration, then people start to lose their central vision. One of the things that's important that we always emphasize is that people over the age of 65, they should probably get a dilated eye exam about every year or two to see if they have these early stages of macular degeneration so we can catch it and treat it in time if we need to.
So it is treatable.
It is. You know, it's very, there's several different risk factors that people have. One of them is age. That's not something you can change.
No.
But there are things that we know that smoking is very bad for this disease. So I always counsel my patients that they should stop smoking. We know that eating lots of leafy green vegetables is healthy for your eye. And there's people with certain stages of the disease of macular degeneration that will benefit from a specific vitamin that's been formulated to help kind of prevent more advanced stages. Now for dry macular degeneration, unfortunately right now there's not a lot out that's available and approved for the disease, but the exciting news is there's a lot of trials going on to develop medications to kind of halt the advancement of the disease. For people with the wet form of macular degeneration, we're very fortunate now that we do have medicines that we can put in the eye to help prevent that kind of leaking and bleeding of the blood vessels to prevent people from losing their vision.
So there is treatment for this as far as you know, putting the drops or whatever you can in it. Would it require surgery?
Well, there's some people, the medicines that we put in the eye are actually injected into the eye, which sounds really scary for people, especially the first time that we tell them about it. But honestly, people do very well with it, and there's many people that have these medicines injected into the eye on a regular basis. So it's a very safe procedure that we do right in the office. It takes a few minutes. Now, some people do require surgeries, especially if there's a really advanced disease like bleeding. And then we are coming out, again, there's clinical trials going on to investigate things like stem cell therapy, where they can actually kind of regenerate the retina that's been lost.
Right.
But that's not quite ready for the market yet, but it is undergoing trials in a lot of the academic centers.
So that's a future option.
It is.
That's a future option as far as the treatment for that. So again, bleeding of the eye, these are some things that they should watch out for.
So things to be aware of, again, if you're not getting a regular eye exam, but maybe you notice that often what people tell me is that when they're reading or they're looking at faces, there's almost like a gray spot that's blocking their vision. Or when they're reading, that words tend to kind of almost drop off the page. So things like that, you should definitely get your eyes checked in a relatively quick manner. But again, the important thing is getting your eyes dilated regularly.
Now, do they need to go to a regular ophthalmologist first and get checked before they can come see you?
Definitely. We're very lucky here that we have so many wonderful optometrists and ophthalmologists right here in the area. So what I would recommend is going to see one of them for a regular exam. While you're getting your glasses done, you can say, hey, can I get my eyes dilated? It's been a year or two.
Right.
And then if they see something that's concerning that they think a retina specialist needs to see, then they're more than welcome to send them to me or any of the other wonderful retina specialists in the area.
Okay. We have a few minutes left. Let's talk a little bit about diabetic eye disease.
Right.
That's another problem. I mean, Mississippi, #1 in the nation as far as diabetes.
Yep.
And so, this is something that really causes problem for our eyes. I mean, we think of diabetes, we think of, your sugar and this and that, and everybody's, maybe, well, not necessarily obese, but it affects so many different areas, and especially your eyes.
It does. And, as a public health crisis, basically, in the United States, there's more than 26 million Americans with diabetes, and there's an estimated 6 million that aren't even diagnosed yet. Diabetic eye disease is very common in these patients. As you said, there's actually blood vessels in the back of the eye in the retina, and these are affected with diabetes. So when those blood vessels get weak, they can leak and cause blurry vision, or sometimes they can even break and bleed, or they can cause scarring, which can ultimately lead to blindness. So diabetic eye disease is a very serious disease for our patients. And again, in the early stages, people don't even know they have a problem because there's no symptoms for it. It's just a matter that we find it when we do the dilated eye exam. So it's, again, just a matter of emphasizing to our patients that if you have diabetes, you need a dilated eye exam at least once a year, even if it's stone cold normal. People with disease in the eye would do like to see them more frequently so that if the disease advances, we can catch it and treat it in time. I
think it's amazing that, people with diabetes, there's so many of them between the ages of 20 to 70-something that...
It is. Yeah, it is. It's the leading cause of vision loss for that age group. So it's basically working age Americans, and that's a horrible thing. If you're blind and you can't work, it's very difficult for patients, obviously. So it's just really important to control your sugar and your blood pressure because we know that actually protects your eyes. And also, again, just get your dilated eye exams done.
And that's, of course, how you diagnose it, is doing the dilations.
Exactly, exactly.
Now, is there anything there that they have as far as symptoms?
So, again, in the early...
I know you can go through it for a while and be fine.
Right.
But then all of a sudden,
sometimes
something's not right.
Right. Sometimes people will come to me and say the same thing, that things look a little bit blurry, or I'm seeing lots of floaters, or there's kind of splotches in my vision. Anything like that are really concerning, and you should be seen pretty quickly.
So, but... I have floaters from time to time, but I'm not diabetic. So, I just figure I'm getting old. So.
Well, a couple of floaters here and there, especially as the eye ages, is nothing to be too concerned about. If it's a new onset of floaters, then yes, you should be seen pretty quickly.
Okay. Well, thank you so much for being here.
Sure. Well, thank you for having me.
And educating us on this. That's great. The Retina Specialty Institute here on the Gulf Coast is located right across the street here from the TV station in the big medical building. Again, you might want to go to your ophthalmologist or optometrist first and have them check it, get your eyes dilated, just to be sure. Especially if you're getting my age, 58 and older, and you might need to go and see Dr. Baranano at the Retina Specialty Institute. Thank you for being here with us today.
Thank you so much.